Welcome, Kristen. I'm really excited to have you here. It was really fun to talk to Andrea the other day, who also works with you at Sage Mother Co. But today we're talking about something completely different to what I talked to Andrea about. Today we're talking about the newborn stage and emergencies that can come up during that time. But before we get into that, I'd love to hear what you have done today to take care of you.
Thank you so much for having me. I'm so excited to be here. Oh gosh, different things that I have done to take care of myself today. On Thursdays, is my day to work on Sage. I don't do clinical medicine on Thursdays, and so it's my slow morning. So I wake up a little bit earlier than the girls. I have coffee, which is my one day a week that I do have coffee. I typically don't have it. And then I sit with my girls for an hour. We don't have any plans. We don't do anything. I take them to daycare late, and that's kind of my reset the week. Let's cuddle. Let's talk about the week. And so that's what kind of brings me back after 3, 4 days, 5 days working clinical medicine that resets my body and brings wellness into my life.
Oh, that sounds like a beautiful weekly ritual. I love that.
Mhm.
So, can you share a little bit about you and what you do and your family? Anything you want to tell us?
Of course, I'm a pediatrician. So currently I'm practicing in Pittsburgh through UPMC Children's Hospital of Pittsburgh. But actually, I'm going to be moving here in a couple of weeks up to Buffalo, New York. So shout out to anyone in Buffalo. I'm going to be moving there shortly. And that's how I spend half my life. The other half of my life, I spend working on Sage Mother Co., which is a company that I built with one of my best friends, kind of supporting mothers and going through that transition from women into motherhood and that early motherhood intensity and helping bring education and support and into calm and confident parenting. And how I got there, I have two girls of my own. I had both girls, the first girl during my residency, and the second we had when my husband was still a resident. And so we had all that stress on top of it. I was lucky enough to have the medical knowledge of being a pediatrician, but it was still a struggle going through the whole identity shift, the stressors of having children, young children, and career changes, and what brought me passion in the professional life and how that changed after having children. So it's been really exciting to be able to work on that and continue to kind of work through that as a family and my professional goals.
So, the work outside of Sage Mother Co. is that with, uh, is it a similar demographic? Like it's obviously still children, but what is the work that you do there?
I'm a general pediatrician, so it's the pediatrician that you go to for your checkups. I see sick kids. I work in a clinic, and I'm their pediatrician that they come to for their visits. And then through that job, I also work at our express care there, and so we have an all pediatrician staffed express care, which is wonderful. And it's kind of another option for when the clinic is closed. Parents can bring their kids there if they're not sick enough to need to go to the ER. Or sometimes they come to us and we say, "You are too sick to be here. You need to go to the ER." And so this newborn emergencies is right in my wheelhouse of stuff that I talk about with parents every single day. And then that kind of fuels into what I do with Sage. And so it's nice to step back and be able to have more freedom in Sage and not have the restrictions and guidelines time wise. In the clinic, I have 15, 30-minute appointments to talk to you. Sage, we have kind of a breadth of time and resources that then we can devote to mothers who need it more.
Yeah, that sounds like a really nice blend to have the two.
Mhm. Yeah,
So,
I love the balance for sure.
yeah, I bet. How do you support mothers in that newborn stage in Sage?
One of my biggest goals with Sage is provide the education. It's not our goal to tell moms how to mother. It's not our goal to tell moms what to do with their child. We want to give you the education and the resources so that you are empowered to make your own decisions for what's right for you and your life and your family. And that comes with my goal to decrease parent anxiety. And so my talk today, I don't want to scare anyone about what can go wrong with baby. Oh my gosh, this is so scary. I want to give you the knowledge on when is my baby okay versus when is, oh, these are signs where I do need to get my baby checked up or I do need to bring them to the ER. If you have that knowledge ahead of time, often it can calm you down a bit when you do recognize, okay, my baby is okay. They're doing all their meeting all their basic needs. They overall look well. Or if there is an instance where it is an emergency, then you know what to do. You're prepared. You're in that mental shift where, okay, I heard about this. I know that this is a red flag. I'm going to get them where they need to be.
Yeah, having that knowledge and that experience is so useful. So I imagine
Mhm.
parents must just like love having those resources. I know my husband is a GP, and there's been moments where I've been really anxious about something, and I look at him and he's fine and not anxious, and he's tells me like we don't have to worry about this. And other times
Mhm.
I can see that it is something that we have to address right away. Like when one of my child had oh, what did he have? He had croup, and I didn't
Oh.
realize that it was like, "Whoa, we need to do
Mhm.
something about this right now." So,
Yeah.
that was really helpful to have somebody there who had that knowledge. So, yeah, knowledge is it's
We
so useful.
Yeah, yeah, it really is. My husband and I joke because our second daughter went through so much in the first couple of weeks of life, not like big things, but little things like clogged tear duct. She was jaundiced. There was a couple extra things where he's like, if you weren't a pediatrician, we would have been in the pediatrician's office every single day those first 2 weeks of life. Whereas I'll look at him, he'd be like, is this a problem? I'll be like, no. We don't need to worry about this one. But then there are those instances, exactly like you were talking about with your daughter and croup, where we lock eyes and we're like, this is a problem. We need to do something about this right now.
Yeah, exactly, and it's so useful to have that knowledge. So, can you
Mhm.
tell us a little bit about, like, what are some of the main emergencies that do come up in the newborn stage? Because I imagine there are a number of them.
Yeah, and I'll kind of do it in tiers. So there are emergencies that I deem like these are reasons to go right into the emergency room. These are kind of the things that you should be most concerned about. And then there's down the line things that a lot of parents come into, when to be concerned about the things that you come into versus like this is not really a big deal. And to start off, a newborn, when we talk about a newborn, I'm talking about the first 30 days of life. That's technically what the definition of a newborn is. Things change after they get a little bit older and they develop a stronger immune system. They're exposed to more things. But in those first 30 days of life, a baby is pretty what we call like sterile. They're not exposed to much. They're pretty susceptible to infections and they don't show many signs of being sick other than a few specific things. One of those things being a fever. So, fever in the first 4 to 6 weeks of life is an emergency because sometimes it's the only sign of a more serious illness, like a infection in the urine, bladder, or blood, or brain and spinal cord. Sometimes that's the only sign that your baby is showing you that they're sick because they can't mount many other signs. They can't communicate to you in other ways. And so that's one of the reasons I would recommend going directly into the emergency room. Now, when I say a fever, that's anything above 100.4 Fahrenheit or 38 degrees Celsius. You don't need to check your baby's temperature all the time. If your baby is doing well, thriving, feeding normally, normal wet and poopy diapers, active and playful, when they're not napping at a normal time to be tired, you don't need to check your baby's temperature. But if you notice, like, my baby's not waking up like they normally are, or they feel really warm, go ahead and check a temperature. I always recommend confirming with a rectal temperature. That's the most accurate. If that's not elevated, sometimes it saves you a trip into the ER and you could just be seen by your general pediatrician or your baby's primary medical provider. And then, kind of the other two that go along with fevers that are at that severity level would be difficulty breathing and then lethargy. Difficulty breathing is one. I tell parents normal newborn sounds are congestion, hiccups, a little bit of sneezing. Those are all things that you can expect during the normal newborn period. And then occasionally you'll hear a cough here and there. If you hear your baby coughing, you don't need to freak out about it or get super concerned, but I do want you to pay attention to their breathing. And so, signs that your baby is having a hard time breathing will be pushing out their belly really big, really fast, more than 60 times in a minute, more than once per second, sucking in around the ribs, the neck, the shoulders, like just using all those extra muscles in their chest and belly with every breath. And then the other thing would be flaring the nose or blue around the lips. Those are all signs where I would say, like, don't go past go directly to the emergency room. Okay. And then the last one would be lethargy. This is a term that colloquially people throw out a lot. And all the times there's a concern like, oh, she's been lethargic. My kid's been lethargic. But to a medical provider, that is actually a scary term. It's much more than just tired or fatigued. Lethargic is you pick up their arm and it flops down. It's like truly they are not waking up. They are very ill and sick. They're pale. And so if you see that, that is directly go to the ER. And those are kind of the the big ones. And then you can kind of move into the next round of things where it's more dehydration or changes in pee or weight loss, throwing up, changes in poop that aren't as scary, but they're kind of more, there's a more of a spectrum of what's normal versus what you should be concerned about.
Okay, so can we talk a bit about dehydration? Because that is one that
Yeah.
seems to be quite common that people are concerned about or experiencing with their newborns.
Yeah. Dehydration is one that you think like, how can I tell if my baby's dehydrated? Wet diapers are a huge piece of that. And so wet diapers from baby to baby are pretty standard. It shows that they are hydrated, that they're getting good nutrition, that their kidneys are working. And so I expect a baby to have about 6 to 10 wet diapers a day. That's pretty standard across the board. Sometimes when they're sick, if they have runny nose, if they're coughing, they're losing, they have what we call insensible losses. So they are losing fluid that way. And so and they're also not really hungry as much when they're sick because they're snotty, their tummy's upset. And so the combination of not wanting to feed as much or as often, and then also losing fluids from runny nose and cough and sneezing, that can lead into dehydration. Slowing of those wet diapers is your first sign. And so if your baby is having less than 3 wet diapers a day or going more than 8 hours without a wet diaper, that's one of your biggest indicators that they're starting to become dehydrated. Once they go in to be seen by a medical provider, we check heart rate. Heart rate is a big sign for us that's the first thing your body does to compensate for a dehydration. And so they can evaluate severity based on that. But other things you can look for at home would be like a dry mouth, dry, irritated, cracked lips, or if they're crying and they typically would cry tears, they're not able to produce that tear. They don't have that extra fluid for that. So those are all kind of signs to look for if you think your baby may be dehydrated.
Yeah, right. I never thought about looking
Mhm,
at their tears. That's such a
mhm,
easy one to look at, isn't it? That's amazing. And what about changes you're saying in like their pee or their poo? Like what are we looking for there that we should be concerned about with newborns?
mhm. The biggest thing is number of wet diapers. The other thing is the color of the pee. The only really scary thing that I think of when I think of pee is if there's blood in the urine. If
Mm.
there's blood in the urine, that may be a sign of something going on with your kidneys, having a urinary tract infection. So if you see blood in the pee, that's a reason to go get examined by your medical provider, and they'll kind of get you where you need to go. It is interesting to know, though, that what we call brick dust urine, so red color, red orange dust like crystals in the diaper in the first couple of days of life is actually normal. And so that's just a normal byproduct of that can happen. Not every baby has it, less babies have it than don't, but it is something that can happen. And then moving over towards poop, unlike pee, poop varies so much from baby to baby. I have a whole talk on constipation and normal poop and all that stuff, but one baby can poop 10 to 14 times a day. One baby may poop only once every few days, and that can be a normal pattern. When you get concerned about poop is if baby is uncomfortable, their belly is hard, you see the poop look abnormal. Normal looking poop can actually range anywhere from yellow, green, brown, as long as it's soft and mushy for babies. Once you get into hard adult like poops, small pebbly poops, then we're getting constipated. If you see blood or mucus in the poop, that's a reason to be seen by your medical provider because it may be a sign of more serious illness or milk protein intolerance or something else going on in baby's body.
So the main things that will show us are if they have an intolerance or they're constipated. Is there anything else that like a strange pose would maybe indicate?
Sometimes it can indicate a viral illness. So anytime a child or baby gets cough, runny nose, swallowing that mucus or a viral strain that affects the GI system can turn into diarrhea or constipation, or sometimes even recovering from that, you can have lingering diarrhea for an additional 2 to 3 weeks. Those are kind of the big things that I think of when I'm on medical brain.
And what about mucus in the poo? Like often that's something that mothers talk about or parents talk about that they can have yeah, mucusy poos, like their babies can have
Mhm.
that. What is that telling us?
That usually triggers me thinking about what we call malabsorption. And so one of the most common causes of malabsorption would be intolerance to something that they're taking. If they're only doing breast milk formula, then we think about the proteins that are in that, which is commonly a cow's milk protein. There can be more serious things if you change that and it's not getting better. There can be more serious GI illnesses of malabsorption. Your body is not adequately producing the enzymes or the stuff that it takes to digest and absorb the nutrients that are coming through. And so that's something else that we consider.
Okay. And you said that on this tier, on the second tier, vomiting is one of them. So sometimes kids vomit or they spit up. Sometimes it's hard to tell if they spit up or if they vomited.
Mhm.
What do we need to be looking out for there?
Yeah, it's very developmentally normal for babies to spit up. You don't always need to be concerned if your baby is spitting up. If they are happy, if they are content in between feeds, if they spit up and go about their life, often you don't have to do anything about it. When I get concerned about spit ups would be if they're spitting up so much volume that they're not gaining good weight, or if they are uncomfortable while they're spitting up, they're extra fussy, they're not consolable throughout the day, it may be causing them pain. And so then we think about reflux, something going on there with that. And then we look into different options for that. And then differentiating between spit ups and throwing up if it's really projectile, if it doesn't look like milk, if it has a what we call a bilious, like a green color to it, a yellow-green bilious kind of look to it, mucusy, then we get concerned about, is there something going on with the stomach, the structure of it? Is there something, an illness going on? So those are kind of key factors to be able to tell the difference. Like, this is just my baby's normal spit up, or if it all of a sudden increases in frequency and volume, then maybe there is something more going on that should be checked out.
And what do we do if they are vomiting and it isn't spit up? Like,
Mhm.
what do you recommend that we do? Is it that we book an appointment with our doctor or we just check to see if they're not feeling lethargic and any of those other signs?
Mm.
What do you recommend?
It's all based on your comfort level. If they are throwing up a couple of times, but overall they look well, if they're staying hydrated, they're having normal wet diapers, they are tolerating some feeds, it's okay to keep them at home and monitor them. And then sometimes while you're sick, if you're throwing up because you're sick, babies can have an intolerance to their current feeds while they're sick. If you think about you and I, when we get sick, milk is the last thing that I want. Milk yogurt, like, oh, it's so thick and gross. And so sometimes they're just not tolerating that more harsh protein while they're sick. And so you can transition to a safer liquid at that time, just while they're sick until they tolerate their normal feeds. So usually I recommend an elect a baby oral rehydration solution. So a Kinderlite, a Pedialyte, something like that can be a replacement to feeds temporarily. Otherwise, we don't recommend any other fluids for babies other than breast milk or formula.
So is that
And
just to keep
then
them hydrated and giving them electrolytes? Is that why you would do that?
yep, it's exactly that. It's to keep them hydrated. It's the next best thing because those electrolytes are aimed at replacing the fluids that you're losing from throwing up or diarrhea. And so that is the extra electrolytes in addition to the hydrations part of it. And then if you notice that your baby is starting to look dehydrated or you're noticing some of those red flags like early fatigue and things like that, yeah, definitely get them in to see their medical provider and they'll be able to look at some of those more um, vital signs and other things that you don't have as easy access to at home to determine whether or not they're sick enough to need to do something about it.
Okay. And I think there was one other thing on this tier that I forgot to write down. Was there something other than the dehydration, looking at pee and poo and vomiting on tier two? Or was that everything?
Yeah, weight loss was the only other
Right.
one.
Okay.
Yeah, so weight loss, we expect babies to lose weight when they're first born. It's normal for them to lose up to 10% of their birth weight in the first 1 to 2 weeks of life. We don't want them to go past 10% because then it's a sign that they're not absorbing the nutrition that they need, that we're concerned that there might be something else going on. And so that if they lose more than 10%, then your medical provider is probably going to want to see them a little bit more often. They might give you more specific instructions on feeds or different instructions on what to feed. And then once they are gaining weight, we just want them to be back up to their birth weight by at least 14 days of life. After that, we expect them to gain about an ounce a day in the first 3 months of life. And so once you've gained weight and we're back up to that birth weight, we expect babies to gain weight. We don't want them to lose weight. And so weight loss can be a sign of something else going on in the body, whether it be you're sick with a stomach bug and you're throwing up and diarrhea. We need to make sure that once they get over that, then we are gaining good weight again. If they are losing weight, is it because something else is going on in their body because of a genetic disease or a metabolic disease? And so weight loss isn't something normal for kids to go through. And so that's something that definitely should be examined by your primary medical provider.
And why do kids lose that 10%? Like, why is that so common?
If you think about during pregnancy, they don't have to do anything. Everything is fed directly to them. They really don't have to figure things out on their own. It's like direct nutrition transfer for them. And as they grow, it's a good life in there. And then when they come out into this cold, dry world, all of a sudden they have to learn how to coordinate all the different muscles and smooth tissue in their gut and be able to get their temperature regulated. There's a lot that goes into being a baby that they have to put energy towards, that it's normal for them to take a week or two to be able to get the hang of it and start figuring things out.
That makes a lot of sense when you put it that way. I never thought about that, that it just takes so much effort to do all those things, right? Whereas before they're
Mhm,
just automatically getting it. Yeah,
mhm.
they're living the dream in there, aren't they?
They sure are.
So is there another tier? Is there a third tier, or is it mainly those two are the things that we should really be looking out for?
The last tier that I have, it's just one additional thing that I don't put in that middle tier is skin changes.
Mhm.
And so it's because I put it in there. I'm not usually concerned about them, but a lot of parents do get concerned about it. So that's why I include it. And the one that I do get concerned about, especially in the newborn period, is jaundice. So the yellow color of the skin. So that's more of almost at that middle tier, but I put it in with skin changes and rashes just because it goes along with everything there as a whole picture. But if you notice yellowing of the skin, especially yellowing of the eyes, that's a reason to follow up with your medical provider because it's a sign of a byproduct of blood breakdown called bilirubin being elevated in the body. And why we care about that so much is because it can pass into the brain and be very harmful to the brain if it's at too high of a level. And so that's very important to watch that and make sure it doesn't go too high, or your baby may need phototherapy or even blood transfusion if it's severe enough.
And why does that happen? Because it does seem quite common that kids do have jaundice when, or like
Mm.
newborns have it early on.
There's lots of different reasons it can happen, and I could do talk for 30 minutes just on jaundice alone. But some of the main reasons, one, if baby has a different blood type than mom. And so our bodies create antibodies to things that are foreign. On our blood, we have different markers that say, this is my blood type. And then if mom's blood type does not match baby's blood type, baby may recognize that and destroy all those blood cells that are from mom, and all that blood breakdown then increases the bilirubin byproduct. So we call it an ABO incompatibility or an RH incompatibility because those are the markers on the blood cells. So that's a big one that we watch for. And in the hospital, if you're born in the hospital, that's something that we pay attention to. We always know mom's blood type. And then if there is an issue, we may check baby's blood type to see if there is a difference between the two that could be a risk factor for jaundice. And then another big one is just the natural birth process. There is blood breakdown that happens throughout the normal delivery process that we expect a little bit of bilirubin product to appear in baby's body. Some genetically, babies are more likely to have it. If there's a sibling in the family who has had jaundice and needed specific treatments for it, then that's a risk factor for that baby genetically. And then
And
one other thing is breast. Oh yeah.
sorry, no, go ahead.
The last one is breastfeeding. So breastfeeding does increase the risk for jaundice. One of the reasons is just because milk production isn't there right at the beginning. It's normal to take 3, 4, 5 days for your body to produce breast milk. And so in those early days, if you're not doing breast getting as much food, your body isn't able to process the bilirubin as much because it goes through the GI tract. And so the more you poop, the more you're pooping out bilirubin. So if you're not getting as much in, you're not pooping as much out. And most babies do just fine. breastfeeding is still recommended as the primary source of nutrition because the benefits outweigh the risks of that. But in certain situations, your provider may give you other recommendations because there's a high risk or because your baby is getting more jaundiced and your breast milk isn't in yet. And they may say, hey, it may be time to do a bottle, but that's a discussion to have with their medical provider.
And the point of having that bottle would be to get digestion going and getting them pooping to get it out.
Hmm. Hmm.
So for mothers who have a different blood type, that sometimes you can get those shots, like the RH shots during
Hmm. Yep.
pregnancy. Is that something that would reduce the likelihood of jaundice in the
Yeah.
child?
Yeah. Yeah. So RhoGAM, the shot that you get during pregnancy, it's if mom is RH negative, it's actually protective for mom. And so if mom is RH negative and there's a risk for baby to have an RH marker, then um, mom gets RhoGAM. It's pretty routine,
Yeah,
at least in the standard prenatal care for them to get that to protect actually themselves.
it protects the mother.
I'm pretty rusty on that one, just because we don't deal with it, but we do care if mom got RhoGAM or not. But I'm not sure the protection of mom versus baby for that
Yeah.
one.
Okay. Yeah, interesting. So in terms of other skin issues, rashes are one. I know that, yeah, for my husband being a doctor, everybody
Yeah.
wants to show him their rashes. It's quite
Yeah.
interesting.
Yeah.
So I imagine that is one that people come in to you with a lot. What do we need to worry about or look for with rashes?
Mhm. I'm mostly concerned about a rash if I think it's an infection or if I think it's hmm, what's the other word I'm looking for? Really, if it's infection or allergy. Those are kind of the two big red flags for skin rashes. And so if it needs antibiotics or antibiotic ointment, it should be seen for that. And that's bright red, warm skin, it's a large surface area, or there's pus coming from it. Those are big signs for an infection, or fever even could happen with that. And then allergy, if it's large red welts. So big hives. People call lots of different rashes hives, and it's the big raised red rash starting across the body and it spreads all throughout. Usually it's within 30 to 60 minutes of whatever triggered it. Those are kind of the more urgent emergent rashes. There are lots of different rashes that can happen with babies. They have sensitive skin. There's normal newborn rashes that we can expect, baby acne. There's milia, those little white spots that you can notice on their nose or across their face. And there's other little spots that can happen across their body that usually go away and resolve on their own. There's lots of hormone changes that happen going from baby in the womb with mom's hormones to now having to produce their own hormones. And so that can change the skin a lot. And then they're just so sensitive. Anything that you put on baby skin, I recommend not doing anything that's scented. That's one of the biggest triggers for eczema or for an irritation or inflammation type of rash. Using all unscented fragrance-free products for a baby. It can be helpful to use a little bit of moisture, but not all babies need it. You can do Aquaphor, Eucerin, Tubby Tod. Those kind of things are all good for baby's skin to add in a little moisture, especially within 5 minutes of a bath. A bath can either be very drying to the skin or it can be beneficial to lock that water in and allow that moisture to stay in the skin for a longer period of time. So putting on that moisturizer within 5 minutes of bath can really help.
And what about using moisturizers like olive oil or coconut oil, things from our kitchen? Is that okay to use during that time?
Yeah. It can be. It can be. It's beneficial, but then there are also scents to olive and to coconut. And so if you put it on your baby and they do great with it, awesome, keep using it. But if you put it on your baby and you notice they are a little more sensitive to it, it could be just that scent alone in the olive or the coconut that could be irritating to them. But oftentimes they're a lot gentler option than the scented products that you can buy from big box stores.
Yeah. And is there anything else that we need to look out for in terms of skin, or are those the main ones?
Those are the main. I guess the only other one would be like the belly button. And so the umbilical cord is attached at the belly button, and we expect it to come off kind of at that 1 to 2 week mark. And then we want to make sure it doesn't get infected. So those same signs that I talked about before, bright red spreading skin around the outside of the belly button, pus leaking from the belly button, or you look in and you see what we call an umbilical granuloma. So when the umbilical cord falls off, that's direct access into baby's belly, inside the gut there. And so we want to make sure the baby is creating a good, healthy tissue barrier in between. We want to see that what we call granulation tissue, which is that white yellow beginning of a scar forming there. If you see pearly pink, it's a sign that there isn't that barrier there, and that should be followed up with baby's medical provider.
Okay. And what about overheating or being too cold? These seem to
Mhm,
be common things that parents are
mhm.
worried about. What do we need to know about that?
That is a really good question. And so normal baby temperature is 36 to that 38.5. Is that what 38? I'm not good with Celsius. Um, is yeah, 38. So 36 to 38 is normal baby temperature. And so 96.8 to 100.3 Fahrenheit, if you go by that. Some babies are better at regulating their temperature than others. If you're born premature, you're more likely to have what we call temperature instability. Some babies don't need any special things for that. If you notice your baby is shivering or cold, add some layers. Skin to skin is the best thing to do to warm them up. If you're not able to warm them up very shortly after finding them cold, that should be seen by a medical provider and make sure they are able to regulate their temperature, because that uses a lot of energy to be able to regulate your temperature and keep your temperature up. And if they're having to use all their energy towards that, then we may run into issues for losing too much weight and not be able to use the energy towards other things that they're doing in life. And then the fever would be the too high of temperature.
Right. Okay. So you're talking, I'm sorry, about newborns being those first 30 days. And
Mhm.
that makes me think about how the postpartum period, we often talk about it being the first 3 months, but really it's those first 30 to 40 days, or even some people or some cultures use the first 6 weeks. And that's the time where ideally you want to be at home and not seeing too many people and be in that newborn bubble. I imagine that part of that is to support the mother, but part of it must be to support the newborn so they don't get exposed to endless
Mhm.
viruses and different things outside the home. How can we help support our kids in the modern day? And when we have other kids maybe and people wanting to visit, how can we help our newborns to stay as healthy as possible during those early days?
Mhm. One of the biggest things that you can do to protect your baby from getting sick at that age, because if they do get sick, they could get very sick. It can easily spread to a more serious infection, would be to make sure everyone knows if you are sick, please don't be around baby. If you have a child, another child, big sib who is sick, as much as possible, like put a holster of hand sanitizer on your hip, or teach them play with baby's feet. Try not to be around baby's face. Different things that you can do, so you see your toddler running around with a boogery, wiping their boogery nose. Hey, buddy, go wash your hands and then we can cuddle on baby. Play with baby's feet. Give baby's feet kisses. Kind of like different ways to target it, or give them assignments where they're not necessarily touching baby, running to grab things, or give them their own baby to play with so that they get to love on their baby while you're loving on your little baby. And so there's kind of little things that you can do, but it's also up to your comfort level. If you want to have people in your home, that's totally okay. Just have a set of safety parameters. If you notice someone's coughing, or if you've heard of someone having a fever, just, say, hey, is it okay if you stay away from baby until you're not having a fever? I think that's a very appropriate ask to have. And a lot of these new COVID moms are just so worried or so concerned. Do I have to have people mask around my baby? That's up to your comfort level. If you are going to be anxious with everyone being around your baby and you feel more comfortable, go ahead, do it. It's your baby. You get to make those decisions. If you like, you care more about people coming in and seeing your baby, being aware that if your baby does get a fever, it's probably going to be a full workup. They include, if a baby under 4 to 6 weeks of life goes into the emergency room because of a fever, their workup often includes a lumbar puncture. And so that's similar to what you get with an epidural, a needle in the back. And so that's scary and that's awful. And if that's something you don't want to go through, lessening your risk for baby to get sick is helpful.
How often does it come to that where babies are being taken to the hospital? Is
It's
it
infrequent.
common?
And so,
Okay.
I want parents to take a deep breath. It doesn't happen all the time. It's very infrequent. It's a scary first month of life, but your baby is stronger than you think. They're more resilient than you think. And as a pediatrician, out of the hundreds of babies I take care of every month, very few of them end up in the hospital with a fever.
Yeah. Well, that's good to know. It's good to be reassured of
Mhm.
that.
Yeah.
So
Mhm.
another topic that I know that you're really passionate about is getting kids outside and getting them in fresh
Mhm.
air. This is one of my key parenting strategies. Just open the door and go outside. If I'm feeling
Mhm.
overwhelmed or grumpy, or my kids are having a hard time, having big emotions, we just go outside, and 95% of the time, everything gets better. Can you talk
Mhm.
to us about why this is such a passion for you and why it's so important that we do get our babies outside?
Yeah, it's funny. Always had a passion for this. Growing up, my parents, instead of going on beach vacations, we went camping. We were always thrown outside, run around with the other kids in the neighborhood, play in the dirt. Like that was always encouraged in our family, and I'm so happy and thankful that that was a part of my childhood, was getting dirty and playing outside and looking at bugs and all that fun stuff. And then when I got married, I took my husband's last name, which is Weidert. So and when I introduce myself to my patients for the first time, I say, I'm Dr. Weidert, like, why play in the dirt? And so I love that because I encourage kids to play in the dirt. There are actually multiple studies coming about how beneficial it is to be outside, to play with dirt, to be at farms. And so there was a big study done at the Wisconsin School of Medicine and Public Health about early farm exposure, early dairy farm exposure specifically is what they looked at, decreased respiratory illnesses, allergies, skin rashes, all these different things because your body is being exposed to all these, what we say, like quote unquote allergens or all these environmental triggers that can happen. And it's actually really helpful and beneficial. There's so many different studies coming out on just the overall general health benefits. There's one that came out of Australia that time outdoors in the sunshine was linked with better mood, improved sleep, overall lifetime decreased risk of depression. That's huge. Like sunshine is so good for your body. Fresh air is so good for your body. It really helps you regulate. It gives you a fresh kind of take on life. It allows you to breathe. And then kind of breathing, definitely something I bet you talk to your um mothers about, the people that you work with, is air pollution. And oftentimes right now, people are looking at air quality. People are concerned about outdoor stuff, but actually the truth is that air pollutants are 2 to 5 times more concentrated inside than they are outside. And so no matter what, like outside is typically better. That fresh air is so wonderful, and there's just so many benefits to it.
Yeah, there are, aren't there? And you feel so much better. That's amazing. I didn't know
Hmm.
about that study with lifetime depression. That's incredible. I wonder if
Hmm.
it's
Yeah.
being exposed to different microbes outside change your microbiome, which impact your brain, or I'm curious to
Yeah.
know
I wonder what
what
it
it
is.
is.
Yeah.
Yeah, but
Hmm.
it definitely does improve your mood and helps you to just feel so much better.
Hmm.
And is that something that you work with kids and parents on in your work and in stage mothering?
Not actually that much. It's just a passion of mine. When I have checkups, general yearly checkups in my office, I always talk about being outside, getting good exercise, decreasing screen time. It's a part of the general recommendations, advice that I give parents. But other than that, it's just something that I like to share.
Yeah, awesome. How can mothers work with you and Andrea in Sage Mother Co?
We have a few different platforms or ways. You can just follow us on Instagram, listen to our podcast that we have. We are Sage Mother Co on Instagram, the Sage Mother podcast on Spotify right now, and hopefully other platform services. And then kind of to get more in-depth resources, we have a few different options. We do have some guides that we created because I'm a pediatrician. Our first one that we came out with was a 0 to 3 month guide, all on taking care of baby in the first 3 months of life. It's a 64-page document. It kind of goes through everything with you, but it is all hyperlinked. In the middle of the night, 2 a.m., when you're like sleep deprived and concerned about your baby's rash, you can open it up on your phone, go directly to the rash section, and then be like, okay, this is when I should be concerned. This is when I shouldn't be concerned. And then we also have a community membership called the Sage Circle, where we provide more more support. There's master classes there. You did one of our master classes, or we have some of your clips on there, which is wonderful. And you can all find all of that on our website, sagemotherco.com.
Amazing. We'll have all that in the show notes, but those just seem like such incredible resources. I love how you make it so easy for mothers because we're overwhelmed and we're tired and
Mhm.
we're worried. So we just need to get to the information as quickly as we can.
Yeah, thank you so much for having me. It's been so much fun.
Yeah, before I let you go, I just have two quick questions if you don't mind me
Mhm.
asking. One is, how do you support your child's emotional development?
Okay.
Or your
So my
children's, I should
child's,
say.
yeah, my children's emotional development, we are definitely dealing with that in our household right now. I have a 2-year-old and a 4-year-old. So we have a lot of emotions developing, big feelings, so to say. And I think one of the most helpful, beneficial things is to regulate yourself. And so modeling healthy emotions, modeling how to go through an emotional experience. If you're frustrated, talk it through with your kid. This is how we kind of take our deep breaths. There's an awesome Daniel Tiger song about count to 4 that my kids love to sing. And they remind me when I get frustrated, Mom, let's take a deep breath. And so modeling as a parent how to have kind of those steps after having big emotions and okaying the emotions. It's okay to have those big emotions. Then we talk about what's not okay to do if there is something going on, like biting or hitting or something like that. It's okay to feel sad. It's okay to be upset. Wow, I saw that XYZ took the car from you. That would have been really frustrating for me too. It's not okay to hit. It's okay to feel upset. Let's talk about what we can do to make our like to work through this emotion, kind of a thing. That's a big thing to help with emotional development.
Yeah, those are huge. So, so good. I'm glad to hear that you're doing that with your girls. And the second question is, how do you help your kids to be lifelong veggie lovers and just lovers of real whole foods?
It starts from the first introduction of foods. The least amount of sugar in the foods possible, the more they see you eat those healthy foods, the more they see it on the table, on your plate, on their plate in a low stress environment, the more likely they are to even put it in their mouth. Sometimes it takes kids seeing that good healthy food 7 to 10 times before they'll even put it in their mouth. Sometimes it takes 7 to 10 times of them putting it in their mouth before they're like, oh, I actually do like this flavor. So continuing to expose them to those good healthy options, veggie options, and getting creative with it. So especially for toddlers, for babies, it's easy. You give them an option. It's fun for them. They get to play with it. They're all interested in these new textures, these new stuff that they've been seeing you eat this whole time. But then toddlers start to get a little pickier. And so bringing them into the grocery shopping, allowing them to cook with you. Hey, you get to pick out this week's veggie. What looks fun for you? Oh, this one looks awesome. This is in a fun shape. This one's a fun color. And just getting different things rather than the same old frozen peas and carrots. But no matter what you're doing, it's going to be okay as long as you're continuing to offer those healthy options. They're going to be well balanced. If they are eating chicken nuggets and ketchup for 1 year, you know what? It's not the end of the world. It's okay. They're going to make it through as long as you're continuing to have an open mind, low stress environment around it and continue to offer those good healthy options.
Yeah, those are such good tips. Thank you. Well, thank
Mhm.
you so much for being on here and telling us so much information. It's really, really useful to know what emergencies or symptoms that our kids have, and what we need to do about that. When is really important to
Mhm.
seek help and when we can wait on it a little bit and observe our kids. Was there anything that you wanted me to ask or anything that we didn't talk about that you wanted to share here?
I don't think so. You did a great job. I don't think there's anything else for you to add.
All right. Well, thank you so much.
Thanks for having me.